Welcome everyone. In this video, Varsha, a third-year medical student, and I are going to talk about biological therapy. You might be wondering, what is that? Well, biological therapy is a treatment that stimulates the immune system to fight diseases, infections, or even the side effects of some treatments. Even though it's known because of its use in cancer, it is used for other diseases and cases. It can also be called immunotherapy or biotherapy. How does it work? Well, it consists of the use of biological response modifiers, which are substances that the body naturally produces in small amounts for fighting disease and infection. But in biotherapy, they use large amounts of these substances produced in modern laboratories. Depending on the case, biological therapies can be given by mouth, intravenously, or as an injection. And who can prescribe it? It is prescribed by specialists who treat cancer, like oncologists or hematologist-oncologists, and other specialists, like rheumatologists, for example. Are there side effects? Yes, but they depend on the type of treatment the patient is receiving. But most of them are flu-like symptoms, such as fever, weakness, or chills. Some patients might need hospitalization during the treatment as they present severe symptoms.
So guys, as you've already realized, biological therapies is a very revolutionizing topic in medicine today, and there are several different applications which I would like to talk about right now of these different biological therapies. So the main one, as you already know, is cancer. Your immune system can be trained to target those cancer cells in a specific way. So for example, in the lab, we teach these immune cells to actually attack the cancer cells once they're inside the body, and then when they go inside the body, they replicate the same process. So that's the idea and the concept around this whole biological therapies thing. An example of a drug is rituximab, which is used to treat non-Hodgkin's lymphoma. So that's an example of a cancer drug which is classed under the biological therapies section. So two other diseases that are involved in biological therapies are Crohn's disease and rheumatoid arthritis. So with these two, the thing is that you have something called TNF alpha therapies. So in TNF, what TNF actually is actually this specific protein that is involved in the inflammatory processes in these diseases. As you already might know that rheumatoid arthritis is a very inflammatory disease. So if you inhibit these proteins, then the severity of the disease should be reduced. So those are two other examples of diseases that can be involved. The other thing is that actually the problem with using these biological therapies is that you have side effects. However, they're not that severe. The thing is that with these biological therapies, you have flu-like side effects. So you get fevers, chills, sweats, nausea, just these kind of things. But overall, this is a very, very promising field for the future of medicine, and it's expected to flourish even further in the next couple of years.